Everyone is talking about something called polylaminin D, which is a substance that could help people who are quadriplegic or paraplegic regain movement. Look, the court has ordered polylaminin to be administered to a pilot who suffered a severe spinal cord injury during a motocross competition in Espirito Santo. Studies on polylaminin have a chance of winning the Nobel Prize. Understand why neurologists warn about the lack of evidence regarding the effects of polylaminin on spinal cord injuries. A Brazilian researcher named Tatiana Sampaio produced this molecule in the laboratory and has been studying it for over 20 years. And now, at the beginning of the year, Anvisa authorized the start of tests for polylaminin to become a medication. So the idea is that, in today's video, we finally learn once and for all what a spinal cord injury is and how polylaminin might be able to help with that. And what are the scientific steps that need to happen for this to actually become a medication that we can buy at the pharmacy. So let's get started. This topic has blown up recently. Everyone's discussing it on social media. It was on Fantastico, and Tatiana was interviewed on Rota Viva. It's starting to feel like a soccer fan rivalry. It's a topic that's even getting a bit too passionate, but we as Manuel do Mundo think it's time to talk about this. After all, it involves a lot of science. So what we want from now on is that whoever watches this video doesn't just stumble into this whole discussion, but at least understands what's going on, and that creating a medicine that works isn't as simple as it seems. Before anything else, I'll just say that I really hope this Polylamina actually becomes a revolution. That people who lost their ability to walk can walk again. That one day, Dr. Tatiana could even win a Nobel Prize because of this. But right now, in 2026, we need to keep our feet on the ground. So, let's start by understanding why people lose movement when they have an accident. Let's use our friend Osvaldo. Here, I'm going to place a skeleton. The back inside the spinal column. Inside the spine, there's a hole through which a bundle of nerves passes. I'm going to install a representation here on our skeleton. It stays inside. I'm going to put it on the outside, but it's just so we can understand. It looks fancy, huh? Just remember it's only a representation. But what happens inside our spine? There is this bundle of neurons, and their function is to communicate our whole body with our brain. So, for example, when I grab something with my hand, there are neurons that start up here, go through my spine, travel down my arm, and reach the tips of my fingers. That's why I can, for example, feel the texture of this chalk. Because that information leaves the tip of my finger, travels up here, and reaches my brain. That's also why I can tell my finger to grab the chalk, because my brain sends that command. It goes back here, comes down my arm, and then I realize that I've grabbed the chalk. The information comes back. I can feel the chalk here. The sensors in my finger are sensing it. The chalk sends the information back to my brain, and this happens throughout the whole body. So these neurons, they spread out. So these ones here, for example, can take care of the sensations we feel. Here at the top of the back, here a little lower, and here at the end we have a split. This part goes to one leg, and this part goes to the other. The name of this bundle, this group of neurons that runs along our back, is the spinal cord. And then, as you might have guessed, when we injure the spinal cord, in an accident, a car crash, a fall, or with some disease, a cancer that can appear here and here, this will impair the communication we have with the rest of our body. So, let's suppose that someone took a really hard hit to the back right around here, more or less, and a bone broke and cut some of these wires. Depending on which little wire was affected here, the person might lose sensation and part of their fingers might not be able to move a leg. Or if the spinal cord was completely severed at that spot, might experience more severe consequences. The person might become paraplegic, losing the ability to move and feel their legs. The higher up the problem is, the more movement and sensation the person will lose. So, if an injury happens here, in the neck area, very close to the head, the person might simply lose all movement because the whole bundle of information passes through here. This means the person won't feel anything anymore, nor be able to move anything at all. From the injury down, the name of this injury is spinal cord injury. Do you understand now that it's something very serious? In practice, people with this usually need surgery, as it's typically a serious injury. So the spine bone breaks, and the spinal cord can be completely severed or just partially torn. There might be bone fragments mixed in there, broken bone mixed in with the bundle of nerves. That whole area will be inflamed. and then the doctors have to take care of it. They have to open it very carefully so they don't make the situation even worse. Remove the small bone fragments that are there, threatening what's left of the spinal cord that's still working. Stabilize that area. Put in some pins or some support there, so that as the person moves, the situation doesn't get even worse. But one thing that doctors still can't do is reconnect the tiny nerve fibers that were cut. The body even tries to do this naturally, but it's very difficult to reconnect those tiny fibers, those neurons that were broken. So far, there is no medicine that forces this connection, but that's what they're trying to do with polylaminin. So let's understand now what this polylaminin is, starting with laminin. It's a protein, a substance that the body produces mainly during pregnancy. When a fetus starts to develop in the mother's womb, there has to be some kind of temporary structure to help the cells organize themselves. If it were a construction, we could think of it as something like scaffolding, a support, those wooden structures that you put around so you can lay brick on top of brick and the house doesn't collapse while it's being built. So laminin is very important during pregnancy. It's a natural substance in our body, but if it helps the fetus build the organization of the cells and everything else, couldn't it help? That's why. By rebuilding a place that was injured here in the spinal cord in a natural way that our own body could do. No, because adults have very little laminin. But what if we took it from a fetus and put it in an adult from the fetus itself? Can't we get it? But there's a lot of laminin in the placenta, which is that structure that connects the mother's body, the mother's uterus, to the baby, which is right before the umbilical cord. This structure, usually, when a child is born, just like the umbilical cord, is thrown away. This is where the research of the biologist and professor at the Federal University of Rio de Janeiro, Tatiana Sampaio, comes in. It was known that laminin alone can't repair this type of injury, but in her research, they managed to organize several laminins together, a kind of turbocharged laminin called polylaminin. This makes the laminin more stable, like stronger scaffold. This structure is called polylaminin because when you join several identical pieces into one molecule and form a bigger, larger molecule, this process is called polymerization. And then you use this poly, which means many, at the beginning of the molecule's name. But okay, how do we use this super scaffold, this enhanced laminin, at the injury site during the surgery, which will have to happen sometime after the accident? At the moment when the doctor opens up and sees the spinal cord, a little bit of polylaminin is injected directly into the spinal cord. And the idea is that the polylaminin can do there what it does in babies, organize the cells and help the neurons reconnect. All of this is in theory, but in practice, what happened? So far, studies have been done in rats and dogs. And at the end of last year, Dr. Tatiana in the laboratory, the pharmaceutical company that's helping her with this research, announced that a study was conducted with 8 patients. These patients had accidents in which their spinal cords were completely severed and they received polylaminin. Not the way I just explained. Wait. Hold on a bit. There must be some neuron connection reversed inside my head because I keep saying polylaminin all the time instead of saying the right thing, which is polylaminin. So let's take advantage of this little mistake to understand the origin of the word. Is the combination of lamina plus in D, which is a suffix usually used for proteins. So it would be like the protein of the lamina. Imagine that the cells in our body work like little bricks, but they don't build themselves in the air. They need to be supported by something. The cells do this on top of the basal lamina, which is a thin little structure that helps the cells organize themselves and grow there. And the basal lamina is exactly where there's a lot of laminin. So that's where the name comes from, the protein found in the basal lamina, which is called polylaminin, or just laminin. You'll hear me say this a few times in the video, but please forgive me. Out of these 8 patients, 2 died from other causes, 5 showed improvement, and 1 patient improved a lot and was able to walk again. Maybe you've even heard of him. It's Bruno de Freitas. In 2018, he had a car accident and suffered a complete spinal cord injury, meaning he broke his spinal cord at the C6 level. C6 is the name of a vertebra here, which is in this upper neck region. C6 is a code we use to identify which bone it is. C stands for cervical, which is this region here in the neck. And 6 is the sixth vertebra, counting from top to bottom. So 1, 2, 3, 4, 5, 6. It was this one here. At this level, his spinal cord was completely severed. He had surgery and received polylaminin 24 hours after the accident. It was very fast. Then he did a lot of physical therapy, and 2 years later, he was recovered. From what I saw him saying on Roda Viva, he can do weight training, walk, drive a car, cook, and everything else. But until last year, nobody knew about this. And then they decided to release this pilot study. This study that was done with 8 people. And that's when the commotion started. Imagine yourself in a situation similar to Bruno's. You have a very serious car accident and your spinal cord is severed up here, above the neck. The doctors say you'll never walk, move your arms, or feel anything below that point. And at the same time, you get news that there's a medicine that's still being tested, but it might give you back the movement of your body. Would you want to take this medicine? No matter what it costs. If this happened to me, I would want to take Polilaminin, no matter what, and that's what's happening in practice. A lot of people are going to court to demand a dose of Polylaminin. The laboratory that is studying the medicine announced that 57 requests were made. The court authorized 28, and these people received a dose of Polylaminin. While all this is happening, there are several reports of people who received this injection through the courts and are already experiencing some kind of recovery. They've started to feel the tips of their fingers. They're starting to make some movements, and this is snowballing. The problem is that we don't have 100% certain that Polylaminin is really effective, and moreover, we aren't sure if it's safe. A study done with 8 people is very small. It's nowhere near what's needed to actually approve a medication. So let's go. There's a laboratory that's studying a new medication. What does it need to do for this medication to reach the pharmacy? At the university or research institute, preclinical tests are done. What does that mean? These are tests done there with the molecules to see if one molecule fits well with another. Then you can do a test on animals to see if it won't harm the animal, to see if it really works and if it's worth continuing to study it. There are a lot of medicines that stop right there. You put it near a human cell, and it already destroyed the cell. It won't work. You have to go another way. So this is pretty basic. If everything goes well, it worked under the microscope, it worked in the rat, it worked in the dog. It's going well, it's recovering. Let's ask Invisa to do real tests, to really try to make a medicine, and then we'll have 4 phases. The first phase is to test the safety. We'll give a very small dose to a few people. If we increase it a little, see what happens. If there is any strange reaction, if it starts to cause problems, the test ends here, so it can't continue, because otherwise it will harm people. This usually takes a few months. Everything went well. Let's move on to the second phase. Let's figure out what the right dose of this medicine is. And now, a larger number of people will receive it here. Let's see what the side effects are. Let's see if we're not giving too much medicine. At this stage, things start to get calibrated. What is the dose that gives the best effect? And at the same time, the minimum side effect. At this stage, you already need to have about 100 people participating. It can take a few years, and these people need to have the condition to see if the medication is actually working. If everything goes well here, we've reached the ideal dose. Let's test this with a lot of people to see if it really works, to see if it's good. This is when we see the effectiveness, to see if the medicine is really working. And for that, we need to compare with other treatments, compare with people who didn't receive the medicine. This last test has to be done with a lot of people, with hundreds of people. Sometimes it happens in several different places at the same time, and it can take years. Think about the slow recovery, for example, of a person with a spinal cord injury. To know if it worked or not, you need a lot of time. If the medication manages to get this far, it will get a license to be sold. From here on, yes, it will appear in pharmacies or hospitals, and people will be able to buy it, will be able to take it. But even so, there is still a phase 4. I'm giving these names in red here. They're not official names. I'm going to call it monitoring, which is to see if any problems are happening, and if any effects are appearing in thousands or tens of thousands, or maybe millions of people who are receiving that treatment. Because even after doing all these studies, Not all possible and imaginable tests have been done. It could be that people with a specific disease, people who have some detail in their bodies, might have a problem with the medication. And this will only be discovered in the final phase. That's what's happening now with those weight loss pens, for example. There are cases appearing that are relatively rare of pancreatitis, which is an inflammation of the pancreas, but this is only being discovered now, years after the medications have already been in use. All of this is very important because when you buy the medication, you need to be very aware of the risks you're taking. And also, you want to know how well that medication works. Because sometimes we buy a medication even knowing that it's not 100% effective. It can fail in some cases, but we need to be aware of that. Imagine the government. Imagine the unified health system, which spends millions, billions of reais on medication. They have to be very sure that money is being invested in the right thing. If it's not money being thrown away, it's people's money that's being thrown away. And what stage is polylaminin at in all of this? Here, those preclinical studies were done with animals, etc. And then after that, they did that pilot study, 8 people. It's a study that doesn't count here. It's a very small study that didn't even have authorization from Anvisa yet. Now, we're also having these cases of people who took it by court order, and these court order cases don't count as a study. Because in research, when doing science, when we're trying to understand if something is really working, we need to know exactly what happened with the patient. Not just what happened to the injury, what the size of the injury is, which region was injured, whether it affected the whole spinal cord or just a part of it, how severe it is, but also what will happen next. There also needs to be people closely monitoring. Did the person really manage to walk again? How long did it take? What kind of physical therapy did they do? This isn't happening in these judicial decisions. In practice, what happens here is that the laboratory conducting the research provides the medication, helps with the application, but they can't follow up after that by law. Since it's not an approved medication, they can't even charge for it. So this tiny study and these people who are taking it by court order don't count in the whole process. It doesn't matter to Anvisa because to approve the medication, it needs to go through these phases of deep study, done with a lot of people and a lot of control. It's great to have someone who fully regained movement, but that doesn't mean everyone will. It could be, for example, that this person's body has something specific. The type of injury she suffered had some detail that made her recover faster. And then you might say to me, hey, Heber, but the Brazilian government and Visa still hasn't approved this study. It's not possible that we haven't already started doing all of this. Yes, it did. Now, at the very beginning of the year, Anvisa approved phase 1 those safety tests. So Polylaminin is just now starting to be tested on people to see if it really doesn't cause any serious side effects, if it's not dangerous. If it passes this first test, the next ones will start to happen. The truth is, knowing ahead of time that a drug is being studied makes us put a lot of hope into it. And we have some cases in history that turned out pretty badly. In 2015, 2016, for example, something called appeared, touted as a promised cancer cure. This created such strong expectations, such great anxiety among people that the court started authorizing people to take this pill. And the Brazilian Congress passed a law so that people could take this medicine without going through any testing. Problem is that phosphorothiolamine was still in preclinical trials. The research was very basic. It hadn't gone through any of that yet. And then, when the tests started to be done more thoroughly, it was discovered that it didn't work. That's not what we expect to happen. That's not what we would like to happen with Polilaminin. But now, here in this video, I hope that when you hear this name, you first remember how the spinal cord works, what this type of injury is like, and how this medication works. But most importantly, all of this still needs to be tested. We are not absolutely sure that this medication is safe. Suddenly, you might say to me, hey, but these people who are receiving it, they don't even have hope anymore. They're in a very serious situation, that's true, but it's not that simple. Just imagine, for example, if something goes wrong when connecting to the spinal cord, and the person starts to feel unbearable pain, like a kidney stone that doesn't stop hurting. And even so, if they don't regain movement, you understand that there's a big risk to take. And whether we like it or not, we need to be sure that the recovery happening with people who are taking the medication isn't just a natural recovery, because in some cases of spinal cord injury, the body manages to do something. and people recover part of their movement. Is it really the medication that's making a difference? This video is being recorded here at the end of February 2026. I sincerely hope that a few years from now, we can come back to this video, look at this board here, and see it with great pride. Went through all these phases, was approved, and changed the lives of a lot of people. But at the same time, we need to take a deep breath and not get into a fan-like, soccer style, or wild, crazy argument. There are still a lot of things to be tested, a lot of things yet to happen. I understand the people who are going to court. If I were in that situation, I would probably do the same thing. But for the rest of society, watching from the outside, we need to stay calm. But regardless of what happens in the future, I think it would be really great if from now on we could be proud and aware that all these tests and all this research are being done by Brazilians at a public university. For those of you who are curious, our Osvaldo, our skeleton, this is 3D printing. There's a really cool video that shows the whole saga we went through to assemble this puzzle with almost 200 pieces that represent the human body.